So first, I would like to ask for your permission to use this video for educational purpose
Yes.
and on internet as well.
Yes.
Wonderful. Now, sacro-iliac joint has been a very gray zone in the spine and orthopedic management as a general. For a long time, we never had a good option for that. And since the last 5 years, we have started having a good option for that. For that reason, we doctors had a benign neglect regarding the sacro-iliac joint. But you went through the whole process. Why don't you tell me how were your symptoms and how long did you have them before the surgery?
Okay. For a period of 2 to 3 years, I was seeking physical therapy help and other chiropractic help to try to help with lower back pain that I couldn't find the solution.
Did nobody even diagnose the sacro-iliac problem? Is that
No,
correct?
that's correct.
So for how long for how long did you have pain in the lower back or SI joint before we figured out it's a SI joint?
Over 2 years.
Over 2 years.
Yeah.
Now, how did we find out that's a SI joint?
Finally, after enough physical therapy, my therapist referred me to your office, and thinking that maybe we would have to do a vertical MRI, but after office visits and diagnosis, we found the SI joint was the primary purpose.
What was the diagnosis? How did we diagnose it?
By some office manipulation, and then we did injections.
How many injections did we do?
3 injections.
How did the injection help you?
The injection was over I would have a maybe 10 to 2 week break in the pain, a significant decrease in pain, and then it would slowly onset back on, and then another injection.
But as a matter of fact, we say even if it helps you for a day, it's a positive diagnostic test. The reason it helped you for longer than a day or two is because I added some steroid to the solution. And the typical diagnostic test is done with Marcaine, which is the same thing that the dentist put in your gum, meaning that that part of it is what helps the first day or two and stay localized. And so the typical diagnosis of the SI joint is serial diagnostic injection, and if the pain goes away even a day or two, then we know that's where the source of the pain is. But in your case, we did diagnose it.
Yeah.
And we did the surgery about 4 months ago.
Yeah, and I should say with the first injection, so I had a lot of tight muscles on my left side all the way through my left side, and the first injection I felt that all release.
Oh, okay.
So it was a significant change from the very onset of the first
Onset of the
injection.
injection. Yeah, and many times, if you have pain somewhere, your body holds you in a location, in a position that it's good for that location, like a SI joint, and that put too much stress on other areas. So that's nothing unusual as well, that if you have pain somewhere, eventually everywhere start paining you. So we did the surgery about 4 months ago. Tell me, how was the surgery, and how were you after the surgery?
The surgery was, I guess typical surgery. So
it took us actually 35 minutes.
It was a relatively short surgery. We did it overnight actually, and in the hospital one night, and just to get pain management. But when I went home, I was comfortable. I was limited in motion, of course.
How bad was your pain before the surgery, 1 to 10?
Before the surgery, it was 8.
How bad was the pain in the first week after the surgery?
5 to 6.
In the first month after the surgery?
It's come down now to about 3.
So right now it's 3?
Yeah.
Okay. Now certain activity is still causing you some pain, I bet.
Yes. Yep. Some. It's gotten significantly better in the last 3 weeks, and I've been moving more now, doing more walking, physical activity, and it's helped.
And you told me as well something about the other side. Tell me what's going on, because when we diagnosed you, we noticed that you have only sacro-iliac disease on the left side, and this is what we fixed. How is the right side doing?
So the right side, since the pain has subsided on the left side, during some of my recent walks and exercise, I will sometimes, when I twist a certain way, I feel a twinge or a sharp pain in the same location on the right side.
Okay, but then, I bet, if you pay attention to that and avoid certain activity, on the right side, the problem is by far not as bad as it was on the left side. Is that correct?
Correct, yeah. It's not near what the left side was.
Okay, so I'm going to just show what we did, obviously, these are the 2 screws that we put in. And in the different pictures as well, we can look at the screws from the front. This is your pelvis, up, down, right, left. And if we move it back and forth, obviously the computer is a little slow, but we are getting there. We see the screws. There are 2 screws, one big one that gives you stability. The small one is just to make sure that it doesn't rotate around the first one. And we pack the space with material that make the bone grow. So this is how it looked like. This used to be a 7-8 hour surgery that now we can achieve in about 35 minutes. And since we have a good solution for that, doctors start paying more attention to that. For a long time, we didn't have a good solution, so there was no reason for us to try to diagnose it well. So overall, do you think the surgery helped you?
Yes.
Okay. Now, what are your level of activity now? What can you do now that you couldn't do before the surgery?
Before I was just trying to do typical routine, like workout routines, and I would have severe back pain. My job is primarily a desk, so during the day I would have numbness and leg pain to my foot, and low back pain, and it was unbearable.
Yeah.
So I couldn't focus in the office. I was difficult at home. It was limiting.
Okay, well, if God forbid you develop the same problem on the other side, how long do you think you're going to wait before you go through the surgery?
Now that I know how that's a possibility, it will fix it much earlier. Yes.
Okay,
I hope,
okay.
yes.
Thank you for the interview.